Have you got the vaccine in-house? And talk me through how big this week is.
Yeah, this is a big week. 9 months of what we've been dealing with and what the public has been dealing with. We're very excited. The vaccines are arriving today on many of our hospitals. We have 150 hospitals across 20 states, and we anticipate vaccine deliveries today. And we've been preparing for that for the last 8 weeks. We've had teams working every day on the logistics and delivery of the vaccine. So we're really excited about this. We feel this is the way to get us on the other side of the pandemic.
We'll hope that's the case, Doctor. When you look at the rollout, it's pretty clear to everyone, frontline workers, the most at risk in society first. Are the decisions on who to give it to in-house first, Doctor, in the initial rollout, the first few weeks, is that difficult? How do you come around making those kind of calls?
You know, we really have strongly encouraged our employees to get the vaccine, and our employees are stepping up just like they have through the entire pandemic and are volunteering. We obviously can't vaccinate everybody in a single unit in the same day. So, frankly, we're just asking people to schedule their vaccine with us, and we are managing that scheduling process just like we would any other appointment. Our frontline workers are really the hospital workers, both nurses, our respiratory therapists, patient care techs. Those are the people that we're prioritizing. And critical care nurses in particular, which really have bear a huge part of the brunt of this, as well as the respiratory therapists and patient care techs, we really want to get them vaccinated early. And so we're prioritizing that group. Our frontline physicians are also very important. Our critical care specialists, our infectious disease specialists, our pulmonologists. We're very excited for our employees and really strongly encouraging them to get the vaccine.
Dr. Cacchione, it's interesting how the initial rollout will be viewed as a template for the further and more extensive rollout that is expected perhaps in the first half of next year. How complicated is it logistically, given the cold temperatures that you have to keep the vaccine, in addition to some of the other just typical vaccine logistical issues?
You know, it is a challenge. You know, we have to store between minus 60 and minus 80 degrees. We have to be prepared to receive the vaccines cold from Pfizer. I will say that Pfizer, I've been on logistics calls with the Pfizer folks. They've done an incredible job orchestrating this. And so I'm very impressed at the way Pfizer has approached this. It has posed a problem. We've had to go out and get a bunch of freezers. Some of those where we can't get freezers, Pfizer has made it so that the shipping boxes that they come in can be recharged with dry ice, and we can store them in the shipping containers. So I think they have done an incredible job doing that and providing us backup plans in case freezers were unavailable. As you can imagine, it was hard to, the number of freezers that we need for a health system our size. We're getting there, but we're not quite there yet.
Which raises a question about who pays for all of the extra equipment that's required in order to roll this out in an effective way. I know there has been some money appropriated that has not yet been passed in Washington, D.C. Beyond your particular organization, Ascension hospitals and healthcare facilities, is this going to be expensive? Who is going to pay for it at the end of the day?
You know, as part of our health system, you know, our CEO told us at the beginning, take care of our associates, take care of our patients, and worry less about the economics. And in a global pandemic like this, with the number of people that have been affected by this and the number of lives lost, we have put our patients and our associates first. And as for that reason, we haven't thought about that as much. It is something that weighs on our mind over the long haul, but for the short term, we're really focused on delivering this vaccine. And for us, we're paying for it. You know, the government has provided us CARES Act funding, but we are paying for it out of Ascension. And this is part of normal business for us. There are technologies that come up all the time that we have to pay for before somebody actually reimburses us. So this is just part of normal business for us. And you know, our commitment to this is overwhelming, to say the least.
Doctor, just before we let you run, I think a massive issue over the last 9 months, as you know, has been compliance around social distancing, mask wearing, etc. It's not just about the first vaccination. You've got to get them to come back. They've got to come back for the second hit. It's going to be hard enough to get people to step up for the first one. Can you walk me through the kind of techniques, the marketing around this that you think is effective, that you'd like to see in the coming months?
Yeah, it's really about education, you know, and we have significant issues in some of our populations that have trust issues. You know, we have the Black African-American population, the Hispanic population that have trust issues with the medical community. We have to continue to educate. We have to be culturally sensitive. We have to use our leaders, our Hispanic leaders and our Black African-American leaders to actually help educate those populations to give them the trust to get this vaccine, because it's a very important. You know, the more vulnerable you are to illness, the sicker you are, the more likely this vaccine is to help you. And so we have to get that message out. It's going to be about education. And I just want to emphasize one other thing. You know, as part of this whole thing, we've been absorbed with COVID, but there is a secondary pandemic that's out there right now, and that is people are avoiding care, avoiding coming to our hospitals. We're strongly encouraging people not only to seek the vaccine, but also to continue to seek care for other medical issues.